Good morning. My name is Wendy Rudd. I am Village and Community Agent for South Somerset, and welcome to today's Talking Cafe live. And we're very lucky today to have as our guest Julie Matthews from the Watch Project, and she is going to be telling us all about it and peer support. Good morning, Julie.
Good morning, Wendy, and thank you very much yourself and Dave for inviting me this morning. I'm obviously from the project manager from the Chard Watch Project, and so I thought I'd actually start off with saying the journey of the project and where we are, how we've come about, and where we are today. So I thought I'd share a particular photograph with you all, and so it says, have you ever wondered how a daisy pushes its way through that dark sticky tarmac on a road? Well, I did, because in 1992 I was walking along the lanes in West Somerset, actually, because I was clinically depressed, and I used to look at the roads, I suppose, because my head was down a bit, and I used to walk along in quite a remote place and used to be amazed at how those daisies used to push their way through. And I used to think, how do they do that? How does a daisy push its way through? And I wish I could be like that daisy, and I wish I could actually push my way out of my own depression. So my depression came mainly because I had gone bankrupt, and it led to a variety of different things. I lost my home and various different things, and it also sort of in a way pushed me into thinking about my past an awful lot. And I started unfortunately going into a decline, and I sort of know what that's like to try and get out of that, out of plummeting. And it's quite easy when you start losing everything to actually find a way out and to come back up. And then and because it was then a mental health problem, you have that stigma and the rest of that adding on to it. So I didn't want to speak to anyone about anything, and I felt ashamed about a variety of different things. And I eventually moved away from the area because I thought I couldn't find a way out. And I started in Chard, going to the day centre, and I started having long-term therapy for quite a few years. And I just felt like this was just going to go on, and the dark clouds were going to be around forever. So I'm at Bracken House. I accessed the day services there, which were a great asset to me at the time, because going to those centres, they actually helped me, because I found other people that had that experience themselves. So there was this mutual understanding, and but I still was in total isolation, and I was there for quite a few years, and I still didn't know how I was ever going to get back to work, how I was ever going to get out of debt, etc. And one particular day, another friend of mine who was also a patient came in and gave me a leaflet on some training that was being offered across the West Country for 35 service users to go and learn about intentional peer support. And this was in 2007. And so I actually thought, well, this would be maybe something I could go and learn about. And the idea was to attend a week-long residential with Sherry Mead and Chris Hansen coming over from America, doing this initial training on how to get people to learn about intentional peer support, and to go back into their communities and set up a small peer group. So I was really interested. So I managed to persuade to get on this course, and I was one of the 8 from Somerset that was able to get onto the course. And it was a totally inspirational course. There I was with 35 other people, similar situations, didn't really want to share their mental health particularly. But so we had a sort of mutual experience together, a sort of mutual understanding. And I came away from that course feeling really inspired and feeling that, yes, actually peer support is really beneficial. And I think we all have experiences of peer support where, as well, if you have someone a sort of the same experience, and you can share those things, because there's that understanding. And so I came back to the day centre, and with 3 or 4 other patients, we formed a peer group, and we called it Chard Intentional Peer Support Group. And we just met in the day centre, and we carried on supporting each other and just talking about our stories, really, and how we were feeling. And I started to feel, instead of shutting everything down, I actually started to feel there were people that understood, because I didn't want to share it with my family, because I didn't want to worry my parents. Sometimes it's difficult for people because they don't feel that they can share it with other people. I felt ashamed. There was a lot of things I was ashamed of. And so I found this support of my peers really, really beneficial. So we carried on as a small group, and unfortunately the day centres, as some of you may know, were closed. So we eventually found some premises, which actually was Forefront Centre, Community Centre, and Forefront Church, which allowed us to use a room once a week to meet. And we did, and we met for quite a while. And we used to start doing drawing and everything. And in fact, we eventually got some funding to create some murals, some mosaics. And some of you may have seen them. But there's one in over in Yeovil. What's it called? Anyway, it's Yeovil, one of the hospitals there in the mental health unit. There's one in Chard Hospital and the Chard Guildhall, and we started to feel that actually we were producing something together, and in a positive way. And then we took on some volunteers that helped us, and we started to get a small piece of funding. Somerset Skills and Learning gave us some funding to do some courses, and we started to feel that we had some purpose. And I think not having hope is really, really difficult, because I always feel if someone hasn't got any hope and they don't know where they're going, it's the loss of their true potential. And so the group grew, and we used to have a lot of fun. We used to go out on trips together, and it grew to about 10. Sometimes it went down to 5 again, or 10 or 12 or something. And then one day, we realised that we were actually accessing the youth centre in Chard, where there was some other funding from a charity which was finishing as well. And we realised it wasn't just people that were isolated with mental health. It could be the elderly, it could be someone with a disability, it could be migrant workers, a lone parent. And so we thought, could we join up? And in fact, at the time, a lovely lady called Lucy from Mind, actually, she was supporting people in Chard, so she joined with us, and we started a community project, and which was called and is called Watch, which we started in 2010, and that stands for Working All Together in Chard. And this is where I've been on an incredible journey, and it's been very, very hard, very tiring, but I have learned so much from people that have joined us. So we opened up, and we had a variety of organisations, from Somerset Partnership to village agents, community agents, and Yarlington Housing that have supported us, a variety of people that have signposted people so that they could actually be referred to us, and had a relaxed atmosphere 1 day a week on a Thursday, which we moved eventually to the Chard Rugby Club because it was just that slightly little bit bigger for us, and some other things that we needed. And we operated there on a Thursday from 11 till 4, having people come in. They can self-refer themselves, coming in and doing activities, and having a hot meal. We'd have a decent hot cooked meal, and it being a very relaxed atmosphere where no one is judging, and where we could actually help knit people together. Because I think if you feel lonely, it's very difficult as well to try and make those friendships. And one of the hardest steps is that first step. And I'm sure the community agents and everyone will know, working with people, that it's very hard to take that step out of home into the community and into a project like ours. And so the project, we're very aware of that, and we've got a very relaxed atmosphere, and that we do a lot of tea and talk, and people can come in and access the activities that we do, which art and all sorts of activities, use of IT. But I think the most important for me in the project is watching the transition and the way people unfold when they feel heard, when they feel supported, when they feel not judged. They don't feel, they start to open up about their mental health and sharing how they feel. And because so many times we feel we can't share what we can, and sometimes we think we can't share when perhaps someone is willing to listen, but we've had so many damaging relationships or experiences. So it's not easy, and I'm not saying that Watch is the ideal place for everybody, but that's what we sort of understand, is that if someone comes in, if Watch isn't the right place, that we can actually help see if there's another community project or something that would suit more. And I think some of the other work that we're doing now is connecting up with some fantastic projects that do conservation work, linking up with people like the Talking Cafe, where we can refer people to get help with benefits, financial advice, job employment, if they need to do that, or volunteering and courses. There's a lot of other organisations that are starting to come into Watch prior to the COVID-19. So the project on a Thursday was part of what we do. Then about 4 to 5 years ago, we had the opportunity, it might even be longer than that Somerset Partnership were delivering self-management courses across the county. And we were asked as a small peer group, could we put something together to share our experiences in a workshop so we could help other peer groups get going. And we did, that for 3 or 4 years with Somerset Partnership, and it was great because in some ways we've come round full circle from being a small little group developing to be able to then do workshops that were facilitated, not training workshops, but facilitated workshops where we could share our lived experience and help people learn the main principles, but help groups set up in their own way, not our way, but have their own voice, set up their own group in their own way, so that they could hopefully set up in different areas and be a support. And so we've been developing that, and that's now been going for a few years. So we've developed courses for Somerset Skills and Learning and Somerset Partnership, and also Somerset County Council, that we managed to get a contract with Compass and Mind to form the Somerset Mental Wellbeing Service, where they have navigators that work on a one-to-one basis, and we do 10-week or 16-week courses to help set up groups and really promote peer support and the value of it. To give you sort of like an idea of how it can work, and I think I've just seen some just fantastic ways of people in that having groups formed their own little group and gone on and do a walking group, a photography group, or just a group that covers lots of activities. And my expectation as well has been a bit unfair at times, because going back to the project, I used to think, oh, people can come in and they can make friends. And there was this particular gentleman, and he's a lovely member that comes in, and he was brought in by a social worker, and he never wanted to really talk or partake. He didn't want to activities. No, thank you. I just want to sit here. In fact, he went and he left, and he didn't want to come back. And then he did turn up all on his own one day, and he just used to sit in the other side of the room and drink a glass of water. He thinks that we do the best water in Chard, and he never interacted much with anybody else. And I used to think, why isn't he joining in with everyone? And then one day he came in at reception and he said, I've got a lot of friends around here. And he said, and he paid his £1 across the reception to come in, and he was only in there for half an hour. And we said, oh, you don't need to pay. So no, I'll go keep this place open. He said, because I've got a lot of friends. And I thought, well, that's strange. He doesn't sort of mix. But my assumption was that he didn't have any friends, that he was actually communicating. But he did. He did have a lot of friends. And that really touched me, to think that sometimes, someone can be connected. They can be getting more benefit out of something than we realize, and that something's unfolding. And he does, mix with a few more people, but he gets something that's meaningful. And someone else actually said one day that they never had any, no one ever used to speak to them when they walked down the street since joining the project. And I guess it would be the same if they joined any project. People wave at them now. And I suddenly realized that I take for granted walking down the road and maybe just say hi to the odd person. But for them, that was keeping them extra isolated, is that no one knew them, that no one waved at them. And I think as well with the COVID-19 situation, that's actually had a bigger impact as well on people that have been isolated for a long time. I was just going to say, because I've only got a few minutes left, and I'm actually going to see if there's anyone who wants to ask any questions and answers. I have a question and answer time. That we unfortunately have had to close down at the rugby club for now. We plan very much to open as soon as we can, as soon as it's safe enough. We do activities anyway to places like Folly Farm and Magdalen Project, lots of trips that we go out and things like that. Some of those have come to a halt, but we're planning to do that shortly. But we're part of, also our organisation, part of the Well Wessex Group, where we've got 4 organisations that have been funded by Lucy Nelson with the Somerset Community Foundation, to 4 grassroots organisations that have come together to help support smaller projects across Somerset. But recently, the latest thing is that the Clinical Commissioning Group and the Somerset Foundation Trust have secured some funding to partner with the voluntary sector to deliver a service, an integrated service. So there's one approach, sort of an open door approach, where people then won't hopefully fall between the gaps. And there's 10 organisations with in the Alliance that have come together with the partnership, and there's 4 localities. So there's one in South Somerset, Mendip, Taunton, and West Somerset, and then Sedgemoor area. So there's 4 localities, and in those 4 localities there are teams now, and that's all. This is all new, and there's going to be crisis provision as well. And people will be able to see the difference in the way the services are going to be working together, so that people will get an integrated service. And and hopefully no overlapping. And I think the more this comes out, and it will be called, and it is called the Open Mental Health Network. So that there's a lot more support. And I'm very encouraged to hear it, actually, because sometimes I think we can go around lots and lots in circles, not knowing where we're going. And so currently Watch has secured some longer term funding, and we obviously get supported by people like Yarlington and Somerset Community Foundation. Lots of independent people donate to us, and we're very lucky that we've been able to sustain ourselves through a very, very difficult time. So at the moment, the members, I don't know if you wanted to know how the members are managed. We do have our own Watcherama and our own video forum. So every Thursday, our members, some of our members that are okay with video, come on and actually speak and keep in contact with us, or we'll ring them and keep in contact with them that way. And also we're keeping in contact with a lot of peer groups across Somerset too. So I think from starting to being a daisy that couldn't find its way out, I did find my way out, and I found my way out by having support and feeling worthy and valued by other people. So so I don't know if there's any questions. Wendy, do you feel if there's any questions?
Hello again. That was really quite fascinating. It's quite normal for us to possibly get all of our questions come after we've actually finished the live broadcast, because the time of day we're broadcasting, a lot of people do come on and watch it as a recording. But I could ask a question, as in, whilst we're waiting, can you tell me more about the volunteering side and how that works?
So we're made up in the project, obviously of a few staff, and we value the volunteers that we have. So if anyone's interested in volunteering, it could be wanting to get involved in administration and in the office side of it, or actually volunteer when we're open on a Thursday at the project, interacting with the members, going on trips with people. And we do have our own volunteer coordinator, Leonie Gerlin, who actually puts any volunteer in touch with our induction process, and they can make an application. And we're always looking for the skills of a volunteer. And the skills are, if you've got lived experience or worked in caring in mental health, and if you haven't and you want to join us, we do have students that come as well that are interested in gaining some experience working in a small project. Then please come as well, because they get some valuable learning there. But yes, there's, in IT, anything, there's quite a range of volunteer roles.
We do have another question come through, and that is, how does someone become a member of Watch?
Right. So to become a member of Watch, you can self-refer. So you can ring up and ask that you'd like to become a member, and we just go through a few questions, and because obviously we just need to make sure of any safeguarding issues, or come through a GP, come through any support worker that you have, Yarlington Housing or any housing organisation for that, and you then will be get a phone call from Abby, our member coordinator, who then does a slow introduction to the project that suits you. So you will have a one-to-one with her until you feel comfortable to actually join the rest of the project. And some people might feel easy just to come straight into the project, but and that's our sort of process into the project. And then we have certain support throughout, but you need to be able to come and go to the project quite freely on your own. So
that's lovely, thank you. No more questions at the moment. Sorry, I was just reading the columns. Dave, sitting quietly in the background there, is keeping us well informed in the comments boxes. Thank you very much for your support as always, Dave. We couldn't get by without you. Unless you can think of anything else that you may want to include.
No, No, the thing that I'm waiting to hear is your delightful poem, Wendy.
We do have one last one snuck in quickly there. If someone's feeling particularly isolated, how does peer support help? And can you give an example of that?
Okay, so if someone's particularly isolated, so I know a lady that is disabled that doesn't come to the project on a Thursday, but actually uses the Facebook page that we have, if that's what it was. And she also comes onto the Watcherama where she doesn't really want to be seen and she doesn't really want to speak. But what she does is she just sits in and watches and listens, and that gives her a sense of being connected. And if then a person does want to actually have contact, then that's where we have great links with lots of organisations that can actually do a phone call once a week. We can ring the person once a week if they become a member, and so we try and reach, because obviously some people are out, can't find transport easily, but we can actually help someone maybe join a peer group that's near them. Or there's also another peer website called, if anyone wants to, is Click, www.click.org.uk, LIC that is. And if you look there, that's going to be somewhere where you can actually speak to other people. And I think anything with speaking to people, and that is a peer that is a peer website, and in fact Somerset's going to have its own part on that website. So I think peer support, you need to speak to other people, and if you want to reduce that isolation, but it's not easy. And I think you know, we do have people that ring and understand that it's difficult to talk sometimes, and it just takes time. And do you think that covers that a bit?
Yeah, no, that's lovely, thank you. As I say, all of the live broadcasts, just because the broadcast has ended is by no means the end of the broadcast, in that the comments box is always available. If you have any questions, please put them in the comments box or PM. You can email Julie. Get in touch with us. We will pass comments, we will pass your questions or queries straight over to her. It is monitored regularly. So whilst, as I say, it's not live, we are still available, as is Julie for you. As Julie mentioned, and as most of you that do watch, I have done another poem, and this one I have done for the Watch project. And it's, are you having a very tough time? There's a project that can help you shine. This help is there, waiting just for you, so your depression you can break through. Break isolation and make a friend. On peer support you can depend. Those dark clouds, they will come and go, but you have strength inside, you know. Within is your own inner blue sky. So come on and join. Don't be shy. That battle with depression can be won yet. There's help available in all of Somerset.
Thank you, Wendy.
You're welcome, and thank you very much. And that brings us to a close. But I'm sure with everything that's going on and all of the new things happening with the Watch project, we will see Julie or her colleagues again soon. Thank you very much.
Thanks, Wendy. Thank you, Dave.
Thank you. Bye-bye.
Bye.